Hello again, Fletch, nurse practitioner with SAP Health. Just wanted to show you a quick way on how to draw up medications with using our insulin syringe. Going for today for our stand-in, here's our bacteriostatic water, but your medicine obviously look different, whether it's semaglutide, tirzepatide, NAD, pentadecaarginate, or the other ones that we prescribe. This was what that bottle would be. So the first things first is you're gonna wash your hands, then you're gonna pull your medicine out as well as your insulin syringe, which is what they look like here. So we take our alcohol swab and our medication, and we're going to open up our alcohol swab because our medication has been in the fridge. We're going to wipe it off. We're going to let it sit for a good 60 seconds or a minute to let that alcohol work as we aggressively wipe that. In the meantime, we take out our insulin syringe. A few different things here. People get mixed up here. So these markers here. That's a 20 for the 20 units, 30, 40, or if you see the what's also the 0.1 ml, 0.2 mLs. So 0.2 mLs refers to 20. The 10 equals to 0.1 mLs. So if you see that, we usually just talk in units. So this is the insulin syringe. So 10 units, 20 units, goes all the way up to 100, sometimes 50. So we're going to pull the bottom cap off. That allows us to draw up the plunger here. And then this is the needle here, obviously. You'd see that, it's so tiny. We take our syringe, we drop to the amount that we want to give. So an idea here is that you're going to go up to the 20 unit mark. See that with the bottom of the plunger there. And then you're going to take the needle, insert it into the medication, push your air in, flip your bottle upside down, and draw up your medication here. You draw up here till you get to the 20 unit mark. That was to follow me here. Once you're there, pull that off. That's, I'm a little bit under, but have your medicine drawn up. Then we take our alcohol swab. We'd apply it to, we'd obviously do it on our abdomen or lower part of our thigh. We're gonna scrub very hard, very aggressively. If you do that for a good 10 seconds, and then let it sit for a good 30 seconds to a minute. But the aggressive scrub is going to help you overload the nerves so you don't feel the needle at all. It's just a trick so you don't feel that at all. Then you'd pinch the skin up, if I can show you here. Pinch that skin up, and you'd inject the needle right up underneath that skin. Obviously, we're not doing it on the hand. You probably don't want to see my abdomen or the front part of my thigh, but that's the places you'd inject, and you could rotate that 4 sides. So either side of the lower abdomen, below the belly button, off to the side of it, usually like 4 inches or so in either side. And then in the front part of the thigh, if you were to go from the top of your hip to the middle of your knee and draw a line, put the dot right in the middle around that area, from side to side right in the middle, pinch that skin up, that's where you inject to as well. But making sure you clean with alcohol.